Hey guys, this is Dr. Hub. So today we'll look at the erythema multiforme. So we are comparing erythema multiforme with the Stevens-Johnson syndrome, and this is versus the toxic epidermal necrolysis. So to start with, we will first focus on the erythema multiforme. So this erythema multiforme, it involves a BSA, that is body surface area, of less than 10%. So what is the causes of this? The causes, it is mainly herpes simplex greater than the mycoplasma infection. So it is greater than the mycoplasma infection. Next is, what are the associated symptoms? The associated symptoms, it includes, there is less fever and other constitutional symptoms. There is less fever and other constitutional symptoms and other constitutional symptoms. So what about the mucosal lesions? The mucosal lesions, it is mild. There are mild mucosal lesions. So after the mucosal lesions, now we look at some of the lesions characteristics. So looking at the lesions, it is erythematus, it is erythematus. Next is, there are papules and there are target lesions. There are raised atypical target. There are raised atypical target. There are lesions and occasional bullous lesions. Next is, we look at the distribution. Distribution is the acral. So acral and distal extremities. Next is, we focus on the HP, that is a histopathology. Under histopathology, the interface dermatitis. So there is a basal cell vacuolization. Next is, there's apoptotic bodies. There is also inflammatory cells, and they are present at the dermoepidermal junction. So they are present at the dermoepidermal junction. Next, we'll focus on the recurrence. So how often does it recur? The answer to this is that it is common. The recurrence is common, and this is related to the herpes infections. Next, when you look at the mortality is rare actually, and it recovers in 1 to 4 weeks. So this was about the epidermal multiforme major. Next, we are going to look at the Stevens-Johnson syndrome. So under the Stevens-Johnson syndrome, this includes the body surface area of less than 10%. And what is the cause? The cause is, it can include, it is drug induced. So drug induced means there is cephalosporin, there is presence of sulfa drugs, as well as there is allopurinol. Next, we'll focus on the associated symptoms. So what are the associated symptoms? This includes, there is presence of fever, there is presence of malaise, and there is also presence of the headache. Next, we are looking at the mucosal lesions. So in terms of the mucosal lesions, there is severe mucosal involvement. There is severe mucosal involvement. So what are the lesions in the case of Stevens-Johnson syndrome? So when you look at lesions, this includes vesicles. So there are vesicles, and this is on the erythematous base. So they are on the erythematous base, and there are also presence of erosions. Presence of erosions. Then purpuric, there is purpuric macules. Then comes the flat atypical target lesions. There is flat atypical target lesions. Now if you look at the Nikolsky scan, it is positive. Nikolsky scan is positive. Then we focus on the distribution. So what happens to the distribution? The distribution is, it is variable distribution. And what about the histopath? The histopath, there is a dermo-epidermal separation. There is dermo-epidermal separation, and there is intense inflammatory. There is intense inflammatory cell infiltrates. There is intense inflammatory cell infiltrates, and this is present in the dermis. It is present in the dermis, and there are some areas of the epidermal detachment and some areas of the epidermal detachment. Next we look at the recurrence. So the recurrence of this, it is uncommon, as well as it is drug related. Then we look at the mortality. So in terms of mortality, it is elevated mortality. Now we'll look at the last, that is the toxic epidermal necrolysis. So let's write it down. Toxic epidermal necrolysis. So toxic epidermal necrolysis, this is the LEL syndrome. The LEL syndrome. So here the body surface area is greater than 30%, and what is the cause? Cause is, it can be drug induced. So it is drug induced. So what does this drug induced include? So it includes the cephalosporin, it includes the sulfur drugs, as well as the presence of allopurinol. It includes allopurinol. Next we look at the associated symptoms. So what do the symptoms include? The symptoms include, there is fever, there is malaise, as well as there is presence of headache. There is presence of headache. Next we look at the mucosal lesions. The mucosal lesions. So mucosal lesions, there is severe mucosal involvement. The severe mucosal involvement. Now let's comment on the lesions. So as far as the lesion is concerned, it is diffuse, it is generalized epidermal detachment. So it is generalized epidermal detachment. Next we look at the TEN with spots. So there is with spots as well as without spots. So looking at TEN with the spots. So this includes a widespread, so it includes widespread purpuric macules. It involves widespread purpuric macules as well as flat atypical target lesions. So it includes flat atypical target lesions. Now we look at the TEN, and this is without spots. So minus spots and plus spots. So in terms of without spots, there is loss of epidermal sheets. So there's lots of epidermal sheets, and there's without the purpuric macules. So it is without. So there's without the purpuric macules or the target lesions. Next is, we need to know that the Nikolsky. The Nikolsky sign, it is positive here. So how about the distribution? The distribution, it is extensive distribution. Then we look at the histopath. Under histopathology, there is epidermal necrosis and there is also the dermoepidermal separation. There is a epidermal separation. Next is minimal dermal inflammatory. There is minimal dermal inflammatory cell infiltrate and large areas of epidermal detachment. Large areas of the epidermal detachment. Next, when you look at the recurrence, the recurrence is uncommon. It is uncommon as well as it is drug related. So what about the mortality? The mortality is, it is the highest mortality. It has the highest mortality. So this was about the comparison of the erythema multiforme major and the Stevens-Johnson syndrome as well as the toxic epidermal necrolysis. To learn and grow daily like this, please do subscribe.